Okay, welcome everyone to a new part of our PPH Insights interview series. It has been an amazing journey so far, and today we are really excited and really happy on having Dr. Tina Shah with us here on our program. So, Tina, thank you for joining us.
Thanks for having me, Sam.
Okay, so the first question that we usually ask to our guests is if you arrive in a you arrive to a room full of people, how would you introduce yourself? What would you say about yourself to introduce yourself with a group of new people?
Can you provide any more information on what type of people or just in general?
In general, let's imagine that you arrive either to a dinner or to a party and you want to introduce yourself because these are people that you don't know who they are. It's new people that you are just starting to get to know. How would you introduce yourself?
So I would say my name's Tina Shah, and I am a person that's really passionate about thinking about how we could get every American to work at the top of their potential. And what I mean by that is I do think that everyone has this potential to be a shining star, but there's pieces that get in the way, one of which is their health and the ability to maintain health. And how do we change the game so people can live up to their full potential? Oh, and by the way, I'm also a physician. I practice pulmonary and critical care medicine and have had over a decade of work in this particular manifestation, which is thinking about one group of people in particular. They're known as elite athletes by my book, but they also happen to be nurses and doctors and physical therapists and case managers, and thinking about how we help these elite athletes run the race as fast as they can to take care of people in our country.
Amazing, excellent. And two things that I hear, Tina, and that I am starting to think about, and I would like to ask follow-up questions a little bit, is I will ask about when and how did you thought and did you decide to go into medicine? But before that, before we go into that question, how would you define when did that interest of making people reach their full potential, when did that came to your mind?
Yesterday. I'm just kidding. Okay, that's a great question. I think the story really starts with I had already committed to being a physician, and I went through medical school. I went through my intern year, did internal medicine residency, and everything was still fine despite how hard some of those years were. And it was in my fourth year of training after my MD where I got so burnt out that I was Googling, how do you make money as a doctor when you don't want to work as a doctor anymore?
Okay.
And thankfully, I found a pathway to stay in medicine myself. And I'm so proud and thankful that I still get to work as a doctor and help people. But there are many that just burnt out and turned out. And I think that experience over a decade ago really shifted me to thinking about people start with ideas, and whether they're in healthcare or not, and they really want to make some sort of impact. And then it's like the environment messes them up. So that's really where it started. I started thinking first about every American, but that's such a huge population to put your arms around that then I started to focus on the healers, because there's a lesser number of healers that touch everyone that live in the borders of our country.
Okay, thank you for that. And then let's move to the next question, because you mentioned that idea and that realization came after you decided, like once you decided you were going to be a physician. So how did that came on in the first place?
Well, I think the sports fans who happen to be in healthcare would probably identify with this, but I grew up playing sports and watching sports. And what I loved was like someone would get hurt and then the trainer runs out, some medical person runs out and fixes them and saves the day. And then the game goes on. And that's why I went into medicine. I was already in love with science, but as I started playing more sports, and my favorite sport is volleyball, I was thinking about the medical team and how crucial they are and how gratifying it must feel to help someone that quickly. So I actually started medical school thinking I was going to be sports medicine. And not to give too much shade to those that are in the sports medicine realm, but I found my home and I think my higher purpose in critical care and in pulmonary. And that's how I landed up in medicine.
Amazing, amazing. Yeah, because as you mentioned, you are currently one of the top leaders in critical care in the country. And then I may ask, was there any point during that career, during medical school, or afterwards when you finish medical school, where you say it's not going to be sports pathway, it's going to be the critical care one? And how did that happen?
Yeah, I think everyone has an idea of what the specialty is. And then once you get deeper and deeper into your training, you really understand what it means. And I really got taken aback when I started getting exposure into the ICU, which is where critical care doctors work, because it felt like being Sherlock Holmes and MacGyver, if you've watched that show, at the same time. So it was so attractive that it ended up resulting in me letting go of my previous dream of sports medicine and jumping into critical care. But I'll also say during that time, and I think I had a little bit of some of this starting at the end of medical school, but it really manifested after my intern year. I realized I had no idea how the place I worked, how it actually worked. Yes, you show up at the hospital, you need to come in at a certain time, you have to figure out what happened overnight, you have a daily workflow. But I didn't understand how hospitals work. How do hospitals work with insurance companies? How does healthcare get paid? But all I could tell was I would do everything and, quote, fix a patient. And then they would come back next week because they couldn't afford their blood thinner. So I really was struck by the end of my first year of residency, known as intern year, where I realized I didn't even understand the place I worked in.
No, yes, and I can fully understand and relate to that, especially the first part that you mentioned about thinking and reading about Sherlock Holmes and like getting to search for answers. Because when I was starting in medical school, it was also the time when I started to learn and to read like the novels and the stories of Sherlock Holmes. And then I knew I was a physician and all that. I was like, man, this is so amazing. And I am curious now. So you could have worked a career only as a specialist in critical care, and that's it. But you mentioned earlier in our conversation that there was a moment of burnout, of starting to search and search on the web. How can I do other stuff not related to clinical care? Do you Could you share a little bit more with us about that period of time in your life? What was happening?
I can, Sam. And no one calls it burnout until afterwards. All I knew was that I watched my peers, the others that were in the same level of seniority as me, and they were happier, they were more engaged. And I just, I felt, no, I'm not them because I'm not having fun. I'm starting to see people as tasks instead of people. The humanism had started to get sucked away. It started to feel like a job, but this isn't one of those jobs that is easy, right? When you're working 80 or 90 hours. Something was off, but I didn't quite know what it was. And now I know that I fit that specific criteria of burnout, which is having one of the three feelings when you think about work. It's an occupational diagnosis. And those three criteria, of which you only need one, they are a sense of detachment, so seeing patients as objects, a lack of accomplishment. You go to work and you come home thinking, did I do anything that actually made a difference? And emotional exhaustion. And as I started my own personal journey and trying to understand what happened to me, but then also working on burnout on a national level, I realized that it doesn't matter how resilient you are. In fact, doctors are more resilient than age matched, educationally matched peers, but we work in a toxic workplace based on all sorts of factors of how US healthcare is designed, down to who we may work with on a day-to-day basis. And that's not overcomable. It really is giving someone a hammer when they really need a big caterpillar truck to move a pile of dirt, let's say. And I then started to understand what the feeling was and then trying to figure out what to do, both for myself and more so, I don't want anyone else to deal with this, because what happens when I get sick? Is there going to be a healer that's fully engaged and able to work at the top of their game? Because that's what I think I deserve, and that's what you deserve.
Exactly. And that's exactly where I would like us to take our next question in our conversation. So you started to think, what am I going to do? What are the next steps? And you have taken several kind of next steps in that area. Could you share a little bit with us about what are those next steps that you have been taking and working on in the last few years?
Absolutely, Sam. And I still want to just express my thanks to those that are listening in that are clinicians, whether they're doctors or other healthcare professionals, and are working full time. And sorry to go back to your previous question, but I think I was so impacted by burnout that I couldn't see a way forward to be a full-time doctor. And it was like almost a forcing me to explore other options. So now that I'm exploring other options, I think one of the biggest things was taking the jump from being a frontline practicing doctor and doing some operations at my health system to being at the highest level of federal government. And I was fortunate enough to enter the federal government at the tail end of the Obama administration through a program called the White House Fellowship, which isn't exactly a fellowship. It's really a roll up your hands and do some serious work. But I was afforded a dual appointment in the White House. And then also, my boss was a cabinet secretary. And so I served the Secretary of Veterans Affairs, which the VA is one of our largest integrated health systems. And I think getting pulled up to understand at the highest level of government how healthcare works, and even to some extent, all of the social determinants, the upstream factors that either make us or break us when it comes to our health, really was one of the pivotal moments that led me down this different path of thinking about burnout and doing something additionally to just working on the front lines as a doctor.
Exactly. And I'm curious because we have all heard, I'm based in Mexico, but we have all heard about the US and the White House and these places where decisions are taken that not only affect the United States, but they can affect the whole world. And I'm thinking, how was it to be in that environment, and how did that shape you maybe in the next steps that you took after that?
It was incredible. Let me just start with that. Tremendous. To go from being a physician sitting in a health system, especially as a doctor who was in training, to being privy to these top secret security clearance type of conversations. And it was an unparalleled look at how decisions get made. And I think what it gave me was, oh, let me take a step back. I think when you're in kindergarten, things are really black and white. And by the time you finish up high school or college, you realize that there's a whole chunk of gray. And at the tail end, you've got black and you've got white. And what my time in the federal government did on a professional level was help me understand exactly how much gray space there was and start to think through not just my perspective or the next two perspectives, but the next 20 perspectives. So we do something in healthcare, and what's the impact on our national security, which is a big one, right? Because we've had all sorts of, as an example, data breaches where our patient healthcare data has gone elsewhere. We're thinking about, it's funny, I actually interviewed and potentially was going to work at the US Department of State, and this was before COVID, years before. And they were like, yeah, we're really interested in healthcare pandemics and how it might influence foreign policy. And we laugh now because it's 100% connected. But one of the biggest things I received was an education and understanding how all the different pieces and parts, transportation, health, financing, how we export and how we import export goods, how they all touch health. And on a personal level, I think my time in the federal government, both making decisions and being next to some of the leaders that grappled with some of the hardest decisions in the country, it's to develop an added layer of resilience. I won't lie, it was really tough. I think I had heartburn for the first time thinking about North Korea and how it was impacting us. At that time, it was a big deal when I was in the government, but also trying to move forward on a project, getting doors shut in my face. But I think that's necessary because we have to develop a very hard shell when we're trying to disrupt the status quo in healthcare. It's an industry that loves staying exactly where it is because of how strong the capitalist forces are.
And now that you mentioned that, how about how we can face the status quo in healthcare and how we can achieve change and make change? I would like to ask you, what steps can a person, a clinician that wants to achieve change and to break the status quo, what will be the steps that you will recommend from your experience with them, to them?
It's crazy. Clinicians have despite how we feel, for those of us that are actively practicing right now or remember it, despite how we feel, because I think most of us feel powerless, we actually have the most power in healthcare, I would argue, maybe second to patients. But the problem is, you said it, Sam, what else should clinicians do? Which means on top of our crazy loads, we're literally saying, hey, victim or person that's being overworked, you need to make change, which means you need to do something additional. And then we're going to give you, I don't know, a mandatory training on it or a playbook that's 1,000,000 pages long. So I just want to acknowledge that the truth is there's a piece of you're already working so hard and you've been, in a sense, the person that's received the consequences of how we designed our healthcare system. And now we're asking you to do more. And it's a balance where you have to think about what's really important and what matters to you. And the fact that we're not just, let's say for me, a doctor and also a partner or also a sister or an aunt, we're still the same person. So part of me wants to say, as a well-being expert, to say, look at yourself holistically and think about how much time you want to devote. And you may not want to devote the time now to become what I like to think of is a clinician activist. But if you do, the first piece, I think, is finding your tribe. And I actually found my tribe in organized medicine. I had a friend that was really involved with the American Medical Association and shifted my opinion from this organization doesn't mean much to me to this organization led me to have a one-on-one with one of the leading senators at the time in the federal government. And I think that's where I realized our voice is huge. So my first thing would be find your tribe. And second would be, if you haven't done this already, I think you need to meet with your legislator. You can invite them to spend an hour with you in the clinic, especially if you happen to have a leadership position, or you can give them a call, or you can send them an email and say, I'm doctor or a nurse, and this is my story, and I'd love to tell you about what we could do to make things better. So with the caveat that we are asking someone who's already being overworked to do more, the reward you get, and by the way, it works and they listen, and then you'll hear them on TV saying something different. It's really an amazing thing to do.
Amazing. Thank you. Thank you. And I totally agree. Finding your tribe, finding your people, and then reaching out and inviting your representative to get to know more about what's happening on the ground. Those are definitely great things that all of us should do. We have like 2 minutes left, Tina, and I would love to ask you a couple of extra questions that I always like to ask our guests. And the first one is there any particular book or video or movie or something that you could recommend to other people that it could inspire them to get into action, to make a change in their communities? Does any book, article, movie, anything comes to mind?
Way to ask easy questions, Sam. Wow. I will say I'm not afraid to share, but I'm like a lover of the self-help section in any bookstore, and I routinely go there because it makes me feel like I'm growing. So I do think there are a ton of books, but one that comes to mind is an oldie but goodie, and it's not directly related to getting fired up in an activist way, but I think this is about setting boundaries and figuring out how to wake up and feel the most comfortable with all of the different hats that one wears. And it's 7 habits, the 7 habits of highly effective people. I know it's an old book, but I still go back to that from time to time because this is about recognizing we've got a finite amount of time. We're not just worker bees. We happen to be all these other things and what's really important. And then I think the other thing is listening to really inspiring speeches, whether it's our presidents of the past or someone like Martin Luther King. I was really taken aback by John Lewis. For a while, I lived in Georgia, which he was our congressman, Congressman Lewis. And this man marched and was a civil rights icon and then became a member of Congress and was tireless. Yet I remember seeing him dancing down an aisle at an event to Pharrell's Happy. And so he was at once a great legend in the US, but then also just a regular human being that was like having a laugh. And I think seeing that normal people do great things really would move me.
I know, yes. I totally agree. And I would like to thank you, Tina, for this time that we have spent in this call. And in our last minute, is there anything that you will share with our viewers? Some last idea you would like to leave everyone thinking about?
Ooh, what would you do if you knew your boss would say yes? What is it that you really would want to do? Because I'm pretty sure it's doable, despite what you might think.
I love it. I love it. Thank you. Thank you very much for this time. And thank you everyone for joining us in our interview series. And keep us in your mind as we continue with our series. Thank you everyone. See you soon.